Welcome to the lecture, Introduction to Anatomy and Anatomical Terminology Part 2, delivered by Professor Dr. Nilesh Kumar Mitra. This is a recorded lecture. As you continue to learn by hearing slide after slide, it is recommended that you pause and go through the slides again by going back and forth to fully understand the concepts. Towards the end, you will see some MCQ questions. You should answer the questions to ensure that you have completed the learning outcomes. Anatomical planes. As you can see in the left-sided picture, the transverse or horizontal plane divides the body into upper and lower parts. It is perpendicular to the long axis of the body. This plane is also called the axial plane. As you can see in the right-sided picture, the longitudinal plane is across the length of the body and divides the body into right and left parts. More anatomical planes. On the left you can see the sagittal plane dividing the body into right and left parts. The sagittal plane is a type of longitudinal plane. On the right you can see coronal plane or frontal plane dividing the body into anterior and posterior parts. In the middle, you can see mid-sagittal plane, which runs across the midline and divides the body into two equal right and left parts. Gross anatomy of the human body is sometimes taught to students as per specific regions: upper and lower limbs, head, neck and brain, thorax and abdomen. Upper limb and lower limb. As you can see on the left side, the first picture shows a dissection of the muscles and nerves of the left upper limb. Next to it is the picture showing a dissection of the muscles and nerves of right lower limb, head, neck and brain. As you can see on the right side, the upper pictures show models of the head, neck and brain, sagittal sections of head and neck, along with the brain lying flat. Thorax and abdomen. In the lower part of right side you can see a dissection showing thorax and a dissection showing the anterior wall of abdomen. Cavities of the body. On the left we can see dorsal body cavities on the posterior aspect of the body, the cranial cavity containing the brain, and vertebral cavity containing the spinal cord. On the right, we can see ventral body cavities. First, thoracic cavity in the chest, containing in the middle heart and on each side two lungs. Lungs are enclosed in the pleural cavity. The space between the two lungs is called the mediastinum. The heart is in the middle of the mediastinum, enclosed inside the pericardial cavity. Second, below thoracic cavity, separated from it by diaphragm, abdominopelvic cavity. Abdominal cavity contains abdominal organs like stomach, liver, spleen, kidney, small and large intestines. Pelvic cavity contains organs like the uterus, rectum and urinary bladder. Human body systems are organized into organ systems. There are 11 systems. Digestive system contains stomach, liver, pancreas, small and large intestines, which help in digestion and metabolism. Muscular system contains the skeletal muscles of the upper and lower limbs, thorax, abdomen, back, neck and becken and face. The muscles help to move the body, locomotion. Integumentary system consists of the skin and its subdivisions. It helps to conserve heat, protects the body from the external environment, and serves to resist infection, along with maintaining certain metabolic functions. Endocrine system consists of multiple endocrine organs, like the pituitary, thyroid, adrenal, pancreas, testis, ovary, and maintains homeostasis and regulates body functions along with the nervous system. Nervous system consists of the cerebral hemispheres, spinal cord, cerebellum, and peripheral nervous system, pairs of cranial and spinal nerves. Nervous systems regulates body functions through its excitability and helps us to think, memorize events, and communicate with the others. Skeletal system consists of the bones of the body, axial skeleton in midline and appendicular skeleton, upper and lower limbs. It helps to move the body by providing leverage mechanism to the muscles and also serves some metabolic functions. The reproductive system represents male reproductive organs in male human body and female reproductive organs in female human body. It plays a crucial role in reproduction and helps maintain the human race. Male reproductive system contains testis, scrotum and penis, and female reproductive system contains uterus, ovary, uterine tube and vagina. The respiratory system contains the nasal cavity, larynx, trachea, bronchi, and lungs, and helps to maintain respiration. Respiration process takes out carbon dioxide and helps to supply oxygen to the cells of the body and vital organs like brain and heart. Urinary system contains the kidneys, ureters, and urinary bladder and helps to excrete the urine, allowing the body receive nutrition and excrete out the toxins. Circulatory system, also called cardiovascular system, contains the heart and blood vessels like arteries, veins, and capillaries. This system helps to maintain life by sending oxygenated blood to all tissues and organs of the body, 24/7. Let's walk through the main subdivisions of anatomy together. 1. Gross anatomy. The big picture. This is the part of anatomy that deals with body parts you can see with the naked eye. You study entire organs, such as the heart, lungs, muscles, and bones. It's how doctors learn what's inside the body during surgeries or dissections. 2. Microscopic anatomy. Zoom in. Now we're going tiny. Here, we use microscopes to study structures that are too small to see with your eyes. Think of it like using a magnifying glass to look inside a Lego block to see how it's made. 3. Developmental anatomy. From baby bump to birth and beyond. Ever wonder how a single cell becomes a baby? This branch studies how the body is formed from the moment of fertilization all the way through growth and development. The early part is called embryology. 4. Surface anatomy, reading the body from the outside, studying what you can see and feel on the outside of the body to guess what's happening underneath. For example, when you put the flat of your hand over the chest, you can feel the pulsations of the heart, which is called apex beat. 2 other subdivisions of anatomy are also used in integration of anatomy knowledge. Pathologic anatomy, organ structure, how does it look when we have disease? Radiologic anatomy, learning about body parts using X-ray, CT scan, MRI scan, or ultrasonography. Gross anatomy, you look at whole organs or body parts, like bones, muscles, the heart, lungs, just like how a doctor sees them in surgery or a cadaver lab. It has a few types too. 1. Systemic anatomy, looks at body systems like the digestive system, respiratory system, etc. 2. Regional anatomy, studies a region of the body, like the arm or chest, and everything in that area. 3. Surface anatomy, helps connect what you see on the outside skin to what's inside, like feeling your ribs or muscles. Microscopic anatomy. Here's where we go tiny. Really tiny. You do need a microscope here. It has 2 parts. Cytology, study of cells. Histology, study of tissues, which are groups of similar cells working together. So if you're looking at skin under a microscope, you're doing histology. If you zoom in even more to see just one skin cell, now that's cytology. Levels of structural organization. Let us discuss how the human body is formed from smaller units to its absolute existence. Smallest unit is a cell. We are surviving and performing all actions as cells work 24/7. They are in billions. For example, brain contains 80 to 100 billion neurons, which are cells of nervous system. Chemicals combine to form a cell. Next, bigger unit is tissue. Multiple cells join to form a tissue. Example, nervous tissue, muscular tissue, epithelial tissue, connective tissue. 2 or more types of tissue join to form the organ, heart, liver, stomach, brain, etc. 2 or more organs combine to form body system, which we have already learnt. And finally, 11 organ systems work together to supper an organism. Human is an organism. Dear students, in this online lecture, we learnt about the proletes anatomy, what the subject is about, Its subdivisions. Positions of human body. You can try on your own. Eye is ear. Shoulder is to elbow. Normal anatomical position. This is important as it is used to describe position of body parts in normal state of human. Anatomical planes. Sagittal, coronal. Body regions, as anatomist, usually dissect. 11. Organ systems of human body. Levels of structural organization. Please try the knowledge check MCQs. Thank you. Please do not forget to try answering the knowledge check questions.